From the 1930s through the early 1950s, doctors didn't just endorse cigarettes in TV commercials, they literally prescribed them as medicine. Physicians wrote prescriptions for cigarettes to treat asthma, throat irritation, and respiratory problems, while appearing in advertisements claiming smoking was not only safe, but beneficial for your health. The R.J. Reynolds campaign claimed more Doctors Smoke Camels than any other cigarette after systematically bribing 113,597 physicians with free cartons at medical conventions. Meanwhile, Philip Morris ads featured doctors claiming that prescribing cigarettes to patients cleared up every case of throat irritation completely. This wasn't just tobacco marketing, it was systematic manipulation of medical authority. The New England Journal of Medicine and the Journal of the American Medical Association regularly published cigarette advertisements throughout the 1930s and 1940s, lending scientific credibility to products we now know cause cancer, heart disease, and countless other health problems. American Tobacco was the first to use physicians in ads, claiming 20,679 physicians say Luckies are less irritating after sending doctors free cartons and asking leading questions about throat irritation. The message was clear. If doctors with all their medical expertise chose to smoke, it must be safe. Unlike celebrity endorsers, the doctors in these ads were never real physicians. They were actors in white coats. Real doctors couldn't advertise due to medical ethics, but tobacco companies created idealized physician images that portrayed smoking as a wise scientific choice. R.J. Reynolds created the most sophisticated medical manipulation operation through their medical relations division, which was actually run by their advertising firm, not medical professionals. They actively solicited doctors with advertisements in medical journals, seeking everyday records of practicing physicians to support their health claims. The 1942 American Medical Association Annual Convention featured a Philip Morris-sponsored smoking lounge, while the 1947 convention showed doctors lining up to receive free cigarettes. Companies like Philip Morris and R.J. Reynolds participated in medical conventions by sponsoring doctors' lounges and distributing free products to influence physician recommendations. To substantiate their more doctors claims, R.J. Reynolds used two survey methods at medical conventions. They gave doctors free packs of Camel cigarettes at tobacco company booths, then immediately surveyed them about their favorite brand. Alternatively, they asked doctors which cigarettes they carried in their pockets, right after giving them free Camels. The strategy was devastatingly effective. By the 1940s and 1950s, the medical community regarded formula and cigarettes as scientifically advanced alternatives to natural approaches, with physicians and consumers considering smoking not just safe, but sophisticated. Perhaps most shocking was the practice of doctors literally prescribing cigarettes as medical treatment. Philip Morris advertisements showed physicians writing on prescription pads, "For your patients with sore throats and cough, Philip Morris cigarettes." These weren't metaphorical, they were actual medical prescriptions. Medicinal cigarettes were widely marketed for treating asthma, hay fever, bad breath, head colds, canker sores, and bronchial irritations. Himrod medicinal cigarettes claimed to provide temporary relief from bronchial asthma and recommended smoking one cigarette upon arising and one before retiring, with severe cases advised to smoke more frequently. One Philip Morris study claimed that after prescribing their cigarettes to patients with irritated throats, every case of irritation cleared, completely or definitely improved. What they didn't mention was that Philip Morris had sponsored the doctors conducting the study, creating fraudulent medical evidence to support their marketing claims. Tobacco companies didn't just buy individual doctors, they systematically corrupted medical research. Philip Morris sponsored researchers to prove their cigarettes were less irritating, funding studies that injected chemicals into rabbit eyes to support their health claims, while other researchers disputed their fraudulent results. The American Medical Association itself became complicit, forming the Committee on Foods in 1929 to approve formula and accepting money from tobacco companies. They created a seal of acceptance program that forced companies to seek AMA approval, essentially monetizing medical credibility for corporate profits. By 1953, the manipulation became unsustainable. JAMA banned tobacco ads from its pages, as other advertisers complained about being placed next to cigarette advertisements. The number of physicians who reported being regular smokers declined from 52% in 1954 to 39% in 1959, as the medical community finally began acknowledging the evidence. The 1964 Surgeon General's report finally established that smoking causes lung cancer, laryngeal cancer, and chronic bronchitis. But the damage was done. Decades of medical authority had been used to promote deadly products, creating a public health catastrophe that continues today. The cigarette doctor story reveals how easily medical authority can be corrupted when corporate profits are at stake. From prescription pads recommending cigarettes to medical journals publishing tobacco ads, the entire healthcare system became complicit in promoting products that killed millions. This wasn't a mistake or ignorance. It was systematic manipulation of public trust in medical expertise. Understanding this history helps us recognize similar patterns today when industries that profit from our health decisions also fund the research and influence the experts who guide our choices. If this revelation about how tobacco companies corrupted medical authority for decades shocked you, hit subscribe for more videos exposing how corporate interests have repeatedly manipulated scientific credibility to promote profitable but harmful products to unsuspecting consumers.